because this new meta-analysis out of the IEA in the UK by Drs. Jonas Herby, Lars Jonung, and Professor Steve Henke finds that basically the COVID lockdowns compares them to a scenario in which, like what Sweden did, which was very minor government restrictions and then extensive public health information and awareness campaigns to allow people to make voluntary decisions. And when it turns out, when you compare these two things, all the lockdowns, all the stringent restrictions, they reduced mortality by about 3.2%. compared to the less restrictive approach of a Sweden or something. So in the US, that would mean it prevented 4,000 deaths. Now we have to go back and compare that to the Imperial College model that was used to sell us on lockdowns that said they would save 2 million lives in the United States. Seems like a small rounding error there, a little bit of a mistake. And then you have to compare that 4,000 lives that may have been saved to all the consequences the lockdowns had, from the mass unemployment to skyrocketing drug overdoses and mental health issues to the domestic violence hotlines ringing off the hook to all these social ills that had lethal consequences in many cases, all for something that essentially did not work. Obviously, 4,000 lives is important. Those people are important. But in the grand scheme of the pandemic, that's a very small amount. And it pales in comparison to the lives lost in consequence of these restrictions. And so they conclude that the COVID-19 lockdowns were a global policy failure of gigantic proportions that failed to significantly reduce deaths while imposing substantial social, cultural, and economic costs. And this is not just one outlier study. This is a meta-analysis that reviewed 19,646 potentially relevant studies, picked 22 that really honed in on the data, and then did a meta-analysis of all these studies. It's been peer-reviewed. I mean, to me, this really is the gold standard of research, and it's really undeniable at this point that this stuff failed.
Yeah. And I think what is so interesting to me is I listened to this podcast called Hidden Brain, free advertising right here. I think it's one of the most valuable podcasts out there. And they had a whole episode shortly as the pandemic was arriving on our shores about how other countries have dealt with other pandemics in the past and what worked and what didn't. And their top finding was that the best thing a government could do in the face of these kinds of tragedies and situations was to ensure that they were giving the people rapid communication, that they were updating them as information changed, that they were keeping sort of a loose fist, not trying to centrally plan or tell people exactly what to do. They were just disseminating information as fast as they could gather it about what the disease entailed, what they thought were the best ways to combat it, and then letting people do what was best for them in a very laissez-faire type way. You can go back and listen to that episode. I wrote an article about their data from that episode, I think in March or April of 2020. And yet we did the exact opposite here in the US. We tried to rule with an iron fist. We made information very difficult to come by. We put out from our federal agencies a lot of actual misinformation. We stymied the free market responding to the disease by limiting testing. There were all kinds of missteps that we made. We did basically everything you should not do in the face of a pandemic. And to be quite clear, we did it for very political, calculated reasons that did not have anything to do with actually protecting lives. They just didn't. Sweden, it's interesting to me, did get it mostly right all along. And it's so funny that the left loves to point to Sweden as this model we should follow, except for when it comes to things that they do like this, or except for when it comes to how free market they actually are and how they limit regulations, and except for when it comes to how they block unions from lobbying the government. On and on it goes, right? They want to point to Sweden, except for all the areas where Sweden does everything radically different than how they want to do it. So I am not surprised to find any of this. And I think that while 4,000 lives is nothing to write off, their calculations that it saved about 4,000 American lives, I don't think that we can empirically, I guess, gather just how many lives were cost, right? It's sort of the broken window fallacy of Austrian economics.
I think we can sure as heck say it's a lot more than 4,000.
And that it's going to be ongoing, because the ramifications of taking away people's communities, of forcing them into substance abuse, of pushing a loneliness epidemic, the suicides that have come and will continue to come from that, the deaths by addiction that have come will continue to come, the domestic violence numbers, which you pointed to, the loss of academic achievement. Those can actually create very lifelong consequences, including poverty, which can cause much earlier deaths. The list goes on and on. I think we can certainly guess that more than 4,000 lives were taken by these policies. But we'll never, it's sort of like when you look at gun data, they'll always elevate the number of people who were killed by a gun every year. They never actually go back and report the number of lives that were saved by guns every year. And I think this is a similar problem where you're not going to see anybody in the mainstream media really championing this kind of information and calling for a reckoning on revitalizing how we would address these things if they were to happen again, right? This kind of massive calamity should come with very serious policy reform. It should come with much stricter protocols for government and how they can operate in these sorts of instances. And I'm really disappointed in people on the left for dropping the ball here, because I think the right really did do a very good job of rising up and pushing back against COVID Inc. for 3 years. And had it not been for a lot of people who were just flat out unwilling to comply with nonsense, they would have gone a lot further and done a lot more and wreaked even greater havoc than they did. But the right did, rise and actually rally to push back on some of their worst ideas, including things like vaccine mandates. The left, however, just completely dropped the ball on human rights, on civil liberties, on basic principles of freedom. And even to this day, seems to have no interest in looking back and discovering where they went wrong and trying to ensure this kind of thing doesn't happen again. There's no interest from Democrat lawmakers in pushing for investigations into COVID's origins. I think it's disgusting. And I know it's really hard when you've been in the wrong and you've been complicit with perpetrating harm against people to recognize it and want to change. This is something the Stoics talked about a lot with Nero, and how few people would rise up to push back against him. And you had one or two, people who've been close to him after decades finally did recognize and start working to overthrow him. But most of the people still went along with it because it was easier to ignore the harm you'd perpetrated than to say, I've made a huge mistake, I've participated in something terrible, and now I'm going to work to remedy it, or to at least try to stop the bleeding. And the unfortunate thing is that most people's human nature is so unexamined. They're so unself-aware that they don't ever do that. They don't hold themselves to account, and they will do anything to prevent having to look in the mirror and recognize their own fault.
Yeah, I mean, I think that's it. It's like this sunk cost fallacy. When you've invested so much into something, you just become more and more determined to cling to it, because if you admit you're wrong, you have to admit all the past things you did and all the harm it caused. And so you have a strong psychological incentive to only seek out information that confirms what you were right, and to push away information that suggests otherwise. And that's why I think we'll see this study echoed throughout right-wing media. And I imagine we'll see it, if not blacked out, largely overlooked and under-discussed by left-of-center establishment media outlets, because they don't want their own records examined on pushing for this stuff. So it's a real shame.